World Kidney Day is a global health awareness campaign focusing on the importance of the kidneys and reducing the frequency and impact of kidney disease and its association with health problems worldwide. And here in Kenya, it's not different. Let's join our reporter, John Wanyama, who is in Uasin Gishu County, where they are marking the day. John, over to you. How is it being marked where you are?
Thank you very much, Zinzi. And this issue of kidney is really a problem and causing pain and suffering among many families. And as the doctor has just revealed to me, that between three people, among three people, one of them is suffering from severe kidney problem, and it's really an issue. And Zinzi, in Uasin Gishu County, the hospitals that are here being led by Moi Teaching and Referral Hospital, they are combined. The transplants they have done for kidneys, they are the one leading in East and Central Africa. Even Nairobi cannot really even try to match it. And only this year, from January to February, hospitals here in Uasin Gishu, they have done 26 transplants so far. Good news, but there is a problem. Zinzi, first let's talk to the head of nephrology here in Moi Teaching and Referral Hospital, Dr. Cheptinga. Dr. Anything to fear?
Thank you, John. Good morning, fellow Kenyans. There is nothing to fear. Today we celebrate the World Kidney Day with the real intention to prevent the kidney disease, slow the progression, and also seek early treatment if they confirm the disease. Kidney disease is a preventable disease. For every 3 people, one has a kidney disease worldwide, translating to 850 million people in the whole world. In Kenya, we don't have the true figures, but it's estimated to be roughly 10% of the total population, and that means it translates to almost 4.8 million people could be having the chronic kidney disease. Mm-hmm. We are happy to share once more that, and we are grateful to the Kenya government for the support they have continued to give to the patients with chronic kidney disease through dialysis and transplantation. Every county today has an active dialysis unit, which has saved so many lives. And also the Nairobi region, as well as Eldoret, we have continued to transplant those who have the chronic kidney disease. Our fear, which we have at the moment, is the support by NHIF of those who have been transplanted has been quite minimal. And we urge them, the government, to continue to look into this matter so that more and more people can go to the program.
Okay, Doctor, we don't have much time, but kindly, if you can just respond on this. Are you having a dialysis machine for children, and are you also worried by the number of children that are coming in with the kidney problems?
Thank you, John. The number of children with chronic kidney disease has really gone up. At Moi Teaching Referral Hospital, last year we had approximately 846 children who came to the facility. We dialyzed a total of 296 successfully. Majority, more than 80%, their kidney recovered and they progressed. I'm really worried for the children because it seems more children are dying outside there because most counties don't have machines for children. And I kindly request our government to look particularly the effects of the children, particularly on dialysis and transplantation for the children.
Okay, thank you. Thank you. Zinzi, I would like to request Winnie, just for 1 minute, there is a beautiful girl here. She's 70 years, Zinzi, but as you can look at her, you will think she's 30 or 40 years. Mama, unaitwa nani? Ulifanyiwa upasuaji wa figo lini?
Mimi naitwa Susan Limo, nilifanyiwa transplant 2015 here at MTRH. And I'm progressing well. I'm doing my work well.
Tatizo, what is the problem now after transplant? Is there a problem?
The problem is medicine. The medicine, NHIF is not paying medicine for transplantation. So it is so expensive to maintain that kidney without this medicine. This medicine is so expensive. Every month we normally use almost 30,000 to 40 for medicine. But in dialysis, it was more cheaper. It was for per month, it was almost 21,000.
Thank you.
So it was cheap. We had NHIF to pay us for that.
Thank you. Since we don't have much time, there are so many patients here, but we will be talking to them in our other subsequent bulletin. But as you have heard, they have one message to the government, that they are requesting that NHIF should not really take up the transplants or the surgeries or maybe the dialysis, but they are requesting the government rather to uptake the drugs, to be buying them drugs after transplant, because they are saying that is a problem. These patients, when they have been transplanted, Zinsi, they have to maintain that kidney entirely throughout their life. They have to take those drugs. They are saying it's very expensive, almost 40 to 30,000 every month to keep that kidney alive and working. We are still following this, Zinsi. We will come back to you and our viewers to update you what is really happening here at Moi Teaching and Referral Hospital.
That's right. That's John Wanyama there, who is keeping an eye on that. Let's pick up that conversation of World Kidney Day. Today being World Kidney Day, this is the sort of thing that is around it. Kidney health for everyone and everywhere, from prevention to detection and equitable access to care. Of course, the main aspect of it is preventive interventions. Joining us here in studio to have this conversation, I have June Azenga. June is a survivor, should I say, of kidney failure, and of course her own doctor, Dr. Jonathan Wala. He is a kidney specialist. Dr. and June, thank you so much for being here. June, let me start with you. How did you find yourself here? What happened that you became, quote unquote, a victim of kidney problems?
Actually, I started having symptoms of kidney failure in 2010. 2010. Yeah, that's when I started having the symptoms, like severe headaches and getting dizzy, and then swollen limbs and my face getting swelled. That's when I went to see a doctor and I was told I have a kidney problem. And I started dialysis that 2010 and had my first kidney transplant in 2012. And did
you do your kidney transplant in Kenya?
Yes, I did. I stayed. I survived. It survived for 6 years. Then it failed again in 2018.
What? Okay.
Yeah. So since then, I've been on dialysis.
All right. Let me bring in Dr. Dr. She's told us one of the symptoms that she felt, headache. What other symptoms can you tell us?
Well, first of all, it's to emphasize that most of the time the symptoms of kidney failure, when they occur, they are too late. Most of the time you cannot recover your kidney function if these symptoms have come as a result of chronic kidney disease, long-term kidney problems. The symptoms, when they come as a result of the kidney not doing its function of removing water, that means the face begins getting swollen, the legs get swollen, later on you get water in your lungs, you cannot breathe properly. And then other symptoms include the symptoms because of too much waste products. And this is too much waste products. They cause a patient to begin having lack of appetite. You feel like vomiting, you begin vomiting in the morning. Those are the symptoms of kidney failure. But as I emphasize again, by the time these symptoms are coming in, usually it's quite late in the stage of the kidney problem.
June has mentioned how when she got her transplant in 2012, it failed again in 2018, only 6 years after. What can make a transplant fail?
Well, a transplanted kidney has come from another human being. That human being is not yourself. The genetic makeup and the proteins inside are not the same, and therefore the body treats this new kidney just the same way it will treat an infection, a virus, a bacteria, a fungus, and therefore it will try to get rid of it. So after the transplant, we give people who have gotten a kidney from somebody else medicines to suppress their immune system, so the immune system does not take out the kidney. So one of the common causes of kidney failure after transplant is the kidney getting rejected by the body's immune system. So there are several other causes, but that's the main cause.
Let's talk about lifestyle, because we know our lifestyle here in Kenya. First of all, you take a look at young people, they are unemployed, meaning they're idle. And on top of that, we know our drinking habits as a community, as a nation. It's also reflected even in our own in our own, what's the term I'm looking for, in our own finances when Treasury decided to even add more tax on what they call sin tax because of the drinking. Let's talk about that, our lifestyle habits, right? What is your advice to the Ministry of Health when it comes to curbing that? Because it's intertwined with what I told you. Unemployment levels in Kenya are its highest. You have idle youth, and then on top of that, we know our drinking habits as a nation. Okay,
you are focusing on lifestyle diseases that can cause kidney problems, and the lifestyle is mainly sedentary lifestyle, wrong diets, and then use of harmful substances, including cigarettes and alcohol. So obviously the sin tax is encouraged because the current guidelines, even for alcohol, puts it almost at the level of cigarette smoking, where no amount of alcohol is safe enough for your health.
So the health, as a health expert, how do we begin to change this lifestyle and this mentality?
I think rather than focus on the sin tax as such, I think we should try and focus in ways in which we can make ourselves more physically active. And this includes how we design our roads, how we allow public transport to occur, how much time is allowed for after work for people to work out, all those things, and encouraging healthy lifestyles. And this begins right from primary school days, where we do our PE, but we are doing it as a subject or as a torture, rather than as a lifestyle habit.
Who are more prone to kidney? Is it children? Is it women? Is it men? Is it a certain age? Talk to me about that.
Well, it distributes across the board, so that children are more likely, children and young adults are more likely to get kidney problems from infections, genetic causes, and sometimes some diseases called autoimmune diseases, where the body immune system attacks its own kidneys. As you get older, then lifestyle problems begin coming in, mainly driven by diabetes and high blood pressure.
All right, June, we need to finish up the conversation. Talk to me about the support you've gotten from your family and friends in terms of financially and emotionally as well.
I would like to say that my family has stood by me ever since I started getting unwell in 2010.
Yes.
Because right now, let's say right now I'm on dialysis and I'm ever weak. So it means I can't do anything in the house. Yeah. So my family does everything for me. They take me to hospital. Sometimes after dialysis I get so weak, they come and pick me. So that's the support I've gotten from family. And friends who call and talk to me and encourage me. That's the support I've gotten from them as well.
Financially speaking, and how much does it cost?
Dialysis. Dialysis costs 9,500 per session. And
so how have you been able to financially support yourself?
NHIF cut us for 2 sessions. And Dr. will tell you that as patients we need 3 sessions so that it can sustain us. But it's so expensive to cater for that.
Right.
Yeah.
All right. Thank you so much, June. That's June Azenga. June Azenga is a kidney survivor. In case you also want to financially support her, you can send your donation to 702-980-01. And of course, Dr. Jonathan Wala is her specialist. He's a kidney specialist as well. Thank you so much to both of you.